Now, Medicare is an important part of many senior citizens' lives, but when paying for prescription drugs, some beneficiaries can fall into a gap that causes them to pay more for their medicine. Now, the Affordable Care Act is working to close this gap, but as one Scottsdale resident found, it might not be working fast enough.
You can't function when you're in pain.
Sandy Block just wanted to take care of her chronic pain and instead was in for a rude awakening at the pharmacy.
And they go $469, and that's for only a 30-day supply. And I said, wait a minute, there's something wrong here. And they go, no.
One reason the cost of Sandy's medicine might have been so expensive is because of something pharmaceutical professionals call the donut hole.
The donut hole is also called the coverage gap. And the donut hole affects about 1/3 of Medicare beneficiaries.
Basically, Medicare Part D beneficiaries are given a limit on how much they can spend on prescription meds during an initial coverage period. After that dollar amount is reached, the patient must begin paying more.
Medicare beneficiaries, unlike any other drug-covered individual in America with health insurance, have sort of a roller coaster of costs during the year.
And the Affordable Care Act could help make that roller coaster a smoother ride.
The Affordable Care Act slowly began to eliminate the donut hole. So between now and 2020, each year there's a gradual reduction in what beneficiaries are obligated to pay.
So by 2020, that coverage gap may be closed entirely. But for now, patients like Sandy could be feeling that donut hole effect.
I don't know how anybody can afford that.
The Area Agency on Aging suggests looking into a pharmaceutical assistance program that can work with a patient's Medicare plan.